Good evening, everybody, and thank you for joining us tonight to our what is second webinar. And thank you to Fred for giving up his time this evening. Fred is an eminent vet at Newmarket and has been involved in rare breeds for a number of years. And tonight he's going to talk about foal and youngstock management and also worms, apparently. So I'll let Fred, with no further ado, launch in. And I think, Fred, are you happy to take questions during the evening as we go through, or do you want them at the end?
I think it'd be probably easier and more efficient if we took them at the end, Mark.
Not a problem. I'll hand over to you, Fred, and thank you very much indeed.
Very good, and I'll see if I can make this technology work. Good evening, everybody. Here we go. Have you got all the slides in front of you? Is that okay, Steph? Can we kick on? Perfect, thank you. Well, good evening, everybody, and thank you for tuning in. A bit different than standing on a stage and lambasting you from there. What I'd like to do, and as I sort of described it to the council meeting a week or 10 days ago, is just do a short, punchy half hour on youngstock management and a particular chapter, a particular topic in youngstock management that is extremely important, and that's worm control. Or parasite control, if you want to use other terminology. The importance of, now let me see, where do I go forward with this? I'll try this way, oops. Got to find the left and right buttons. Why aren't you going forward? Why aren't you going forward? Next, there we go, it says next here. Perfect. The importance of worm control or parasite control is obvious, one would think, to most of us. If we want to rear healthy horses, sound horses, and horses that are able to perform in their adult life and are marketable, the rearing of the young stock is extremely important. And there are all sorts of aspects that come into the rearing and management of young stock. Starting with handling, and then obviously health control, disease control, and prevention, and primarily prevention of infectious diseases and parasitic diseases. And so tonight, let's just concentrate on this one aspect of worm control, because I think, in my experience of day-to-day practice, that this is an area where sometimes some of us are a little bit lacking. And also where those who have been overzealously controlling worms over the years, and maybe the big industry such as the thoroughbred industry, have also caused problems by trying to overdo it. So let's first of all think about what the best strategy is to manage our animals to maintain the lowest possible worm burden. And there, it's a combination of management treatment strategies. And one of them is to really try to reduce the environmental parasite burden. And in the picture there on the right, you can see a group of youngsters in what would not be called ideal paddock conditions. They're in the dirt, in the dust. They have got water, yes. But you can see in the background, they've also in a field with ragwort in it. So these youngsters, the one lying in the sand there and the foal over by the trough, really haven't got the best start in life. And I think it's important that we should ensure that our horses get the best start in life. So to try to control this, we need to manage our environment, be that stables, the paddocks, and the animals themselves. So we'll go through this in slightly more detail further down the line. But it's a combination of managing the paddocks, managing the stables, diagnosing and making sure that the animals have only got a minimal worm burden, and managing that only when necessary with drugs, which are wormers, because these drugs are becoming less and less effective because of drug resistance. So prevention is better than the cure. And we saw in the previous picture a high stocking density. Here we've got a relatively high stocking density within this shed, but we've already got a first step that might be useful to manage a worm burden, and that is mixed grazing with these sheep. What is not good in this picture is that if these animals were all in that enclosed area all the time, they would be in what we call deep litter. So they would be passing their droppings into that deep litter, and there the worm burden would go up. Why is it good to have them with cattle or sheep? Well, because very simply, they share very few, if very few parasites between them. In fact, there's only one that they do share between them. So when they are mixed, when we have mixed grazing, the animals are actually cleaning the paddock between species for each other. By the way, that's my own field shelter with our sheep and our horses. So I'm not picking on anybody. This would not be ideal if the animals were like this all the time, but they're outdoors all the time, and this is they come in to just for some into this area to get away from the wind and rain and to get some hay in the morning, but otherwise they're out in the paddock. So low stocking density is important. Pasture rotation, well, that sounds grand and great, especially from a vet who works in Newmarket, because we can do it in Newmarket on the big thoroughbred farms. Many of us in our private environments can't necessarily do that, but we have to address it. And then paddock cleanliness. You can save yourselves fortunes in wormers if you just pick poo. Simply pick up the poo, pick up the droppings, and the same applies to deep littered stables and to stables as well. We've talked about mixed grazing. And one thing that works quite well, if you insist on putting the manure back out on the fields for fertilizing, then it must be composted for over a year to try to break down the worm eggs and the larvae that are in that in the droppings. So it is an option. One can do it. There's one very successful thoroughbred farm not far not far from here, down in Hertfordshire, that has a very elaborate composting structure where they pick the droppings off their paddocks and their fields, and they put it through a composting system, and then refertilize the fields with that manure about a year or 18 months later. But we've tested those and just checked that over the time, and we can't find any worm eggs in that system. So it can be done, but don't spread fresh manure, fresh horse manure on your own fields immediately. Ideally, the horse has developed in this type of environment. This is Mongolia, and you can see here the acreage, the vast acreage of the open steppes and a few horses on it. Well, in that environment, horses have a very low worm burden. There is no such thing as a worm-free horse, nor should there be. But it's all a question of how much and how intensely the parasite burden is within the animal, and the higher the parasite burden, the greater risk to the animal's health and development. So density of population, both the adult horse and the worms, have a big influence on horse health. And we have a decrease of worm burden during the cold winter months. Surprise, surprise. The worms aren't as active. And in hot, humid conditions. I've put that in brackets. Why? When do we have hot, humid conditions in this country? So it's really, there is a slight decrease during the cold winter. And it is very important that if you're managing your pastures, that you deworm horses before moving on to fresh grazing. No point taking the horses and having them pass their droppings on fresh grazing. You want to deworm them before you move to a fresh paddock. And then move the stock from the used to the fresh and minimally contaminated pastures. And this is especially important for mares and foals and youngstock. Keep foals and youngstock on the cleanest available pasture, because they are the most susceptible to picking up different types of worms. And again, it would be ideal if we could do this all the time, but try to keep your age groups separate. Here I am fully realizing that many of us only have 1 or 2 horses, but think about it if you are in larger stocking areas and have larger groups of animals. What do these parasites do? Well, it all depends on the type of parasite, the burden, and very importantly, the animal's immune status. We all know from the current COVID pandemic that those who have underlying conditions, underlying diseases, are more likely to succumb to COVID. Well, That's the same with any infectious disease and any parasitic disease. If the horse is a healthy youngster, then it is more robust in the face of a challenge by parasites or worms. So weak, younger animals, and for that matter, also old animals, are more susceptible to worm damage, and it's important that those are all managed accordingly. So what happens? Well, on the right, you've got some nice grass, and in the middle there, you've got some horse dung. In that horse dung is not an inert material. That is a very live piece of droppings. And in those droppings are little worm larvae and even adult worms. And they need to find a new host because their previous host has just expelled them in their droppings. So they need to find somewhere to go to continue to thrive and continue with the worm's life cycle. And they do that by crawling out of those droppings and attaching themselves to the grass. And then the animal on the left is grazing quite happily. And if the area is contaminated, then the horse will pick up the worm eggs and larvae, and they will pass back into the horse's gut and go through a worm cycle. So that is a natural way that worms continue in their existence and procreate. So that's basically the worm's life cycle. And what we have here on the left in this picture is a worm egg. And you'll see that, and that's the same size, same magnification as a structure in the middle here, this one here, and that is a small larvae. And so there are various stages of worm eggs, and they're ingested and then create these larvae, and these guys then travel through the body and cause damage. So what we have here is, just as an example, a redworm life cycle. We have the egg, which is produced by the adult inside the horse. The eggs are then passed in the droppings, and they go into the grass. And these eggs then hatch, and we have various, depending on the type of parasite, different types and different stages of larvae that go through various life cycles stages outside and inside the animal. The worry we have is when we have too many inside the animal, and each of different type of worm will then create its own damage in its own specific way. We'll have touch on a few of these problems in a second. So what are the common signs of parasitic illness? Stunted growth, weight loss, pot bellies, inefficient digestion, which might result in diarrhea, loss of proteins because the digestive tract is becoming more porous, and proteins are lost through that way. So that's where we have weight loss. We have colic because we might have blockages. We'll show you some examples in a second. Diarrhea, pneumonia. Why on earth pneumonia? Well, some of these worms, in the various stages that they develop in the horse, actually travel through the liver and through the lungs, and they can cause damage in the lungs that leads to pneumonia. And the worst case is obviously the horses succumb to this and die. So let's see what else we've got here. Well, which are the most common parasites that we talk about? You'll see and you'll recognize some of these names. And I'll just touch on the ones with the little stars, because they're actually the ones that are probably the most present in our minds, although we will find some other ones as well. So we have the redworm, we have something called small Strongyle, especially important in youngstock. Redworms are the ones that cause the most damage across all age groups. And we'll talk about them specifically. We've got the roundworms that look like spaghetti, and I'll show you. I hope you've all had dinner, because I'm going to show you a cracking video in a second. We've got bots. Now, bots are flies actually, but I'm not going to go into depth on those. But you'll all recognize bots by the bot eggs that the horses carry on their legs. Bot eggs on the horse's legs in the summer, which are then licked by the horse and swallowed, and those eggs develop into larvae inside the horse, and then come up and can cause problems in the stomach. But I'm not going to go into those in depth because they're more of an older horse issue. Pinworms we see occasionally too in this country, more so in warmer climates. I'll talk about some problem with tapeworms and something very specific to the newborn foal, which are threadworms. We've got, let's start with the red worm. Now, if you look at this poo, these dropping samples here on the surface, you can see these little red worms. And it's actually very rare that we see the adult red worm in horse droppings. This is a horse that is heavily infested with parasites to the extent that it's producing these red worms. Why do we get excited about red worms, and why was it such a problem in the past and may become a problem again in the future? Well, the red worm, as we said, goes the cycle inside the horse, causes problems because the larvae dig themselves into the blood vessels and travel along the blood vessels, causing damage to the blood vessels. And by doing that, wherever they go, the damage to that particular part of the body, be that usually in the digestive tract or further down in the limbs, will cause typical signs. The most classic problem with red worms is colic. And when you have a colic, it usually affects the blood supply to the large bowel, to the hindgut. And here you've got the hindgut of a horse that has succumbed to colic. And you can see how the coloration of its colon here is different to the healthy structure there. And what has happened here, in fact, is that the blood supply to the colon has been disrupted. This has caused change in the motility in the gut of the gut wall, change in the position of the gut wall, and caused damage. And if you look here on the right, this is the inside of a very large blood vessel in the horse, and you can see scars along that blood vessel, which are typical of the migration of these larvae from the red worm and the damage they cause. So if that damage to that blood vessel is down by the lower, at the end of the biggest vessel in the horse's body, the aorta, which goes down to its legs, and if you have damage there to the wall of the aorta, you'll have a damaged blood flow to the leg. And as the horse exercises, it doesn't get enough blood supply to its leg, and it goes lame. That was a classic sign before the age of wormers of red worm damage, other than horses dying of colic. We might see this again in the future. Why? Because many of these red worms have become resistant to the wormers, the anthelmintics that we have been giving them. We'll talk about that a little bit later. As there are large red worms, there are also small red worms, and there are many of these. And these are a particular problem for youngstock. And your vet might have spoken to you about cyathostomiasis, big word. Don't try it with too many beers in you. But what happens here with these animals, and is that these are typically older foals, weanlings, sometimes yearlings. Excuse me for a second, I'm going to close the door because my dog is barking in the background. I'll be right back. Right. We'll still hear the dog, but anyhow. So what happens with these small Strongyle? They live, the problem with these guys, and you can see an egg, a picture of an egg here up at the top corner, and you can see a youngster here with, well, we can't really tell us how poor its condition is, but it's in poor bodily condition. It has had a chronic weight loss, and it's quite lethargic. It's not thriving, and it's just blah. It's just not happy, and you can't quite figure out why. It's might be eating, but it's not eating well. So that's a typical sort of hint towards this disease. And what happens here is that these worms, or the larvae from these worms, live in the hindgut, in the large bowel, like we actually saw that damage in the previous one of the red worms, but these actually live in the hindgut wall and get encysted in there. So they form little cysts in the hindgut. And with that, they're very difficult to treat and also quite difficult to diagnose. So the only way we can actually deal with these and it's typically sort of spring, autumn, is that we have to target the treatment specifically. We'll talk about treatment in a little while, but it is a typical Youngstock issue, and it is important that we worm, especially the foals, on a regular basis to try to help avoid this particular parasitic infection as well. Now, this is the life cycle, similar to the red worm we saw earlier, the same theme every time. The foals grazing, and it passes the eggs in that come through the hindgut onto the field, and these then go through the various larval stages, go are ingested again, are eaten again with the grass, and then go into the animal and start their damage within the animal at that stage, which is mainly damaging the gut wall. This here is in a dropping sample, which was sent to our lab. They picked up a larval stage of this small redworm, and you can see how that moves around inside the droppings. Sorry, this is an adult worm, not a larval stage, it's an adult worm that is moving around under the microscope. So that's roughly how they're tiny structures, so we won't necessarily see them. We won't see them with the naked eye, but that's what we would be seeing under a microscope if we're looking for them. So those were the small redworms. We're going to jump onto something else now, which is a classic problem in foals, and to a lesser extent, but also yearlings and 2-year-olds, and we should really not be seeing this. The picture on the right is taken from a Suffolk foal, and that's what came out in its droppings, spaghetti. And no, it hadn't gone to Italy. These are worms. We should not be seeing this. What happens with these foals if they're infected, as you can well imagine, this can block up the bowel, and it can lead to colic through impaction of the gut by obstructing the gut. If it's really we have a very large burden, the gut can actually rupture, colic and then rupture. What we'll see quite often without the colic symptoms is is poor condition. Why? Because the foal's actually feeding these worms, so it's not putting on weight. It's got a pot belly, and again, lethargic foals and pneumonia, because this particular worm will go through the liver and into the lungs, come up the windpipe and be swallowed back down into the gut, where it becomes an adult and is then passed through out in the feces. So this is a foal, the life cycle in the foal. You can see the adults are in the intestines, the eggs are passed in the feces, the larvae develop outside, the eggs are again picked up by the foal, the eggs hatch in the intestines, the eggs hatch into larvae. These migrate through one of the major blood vessels to the liver. From the liver, they migrate to the lungs, cause damage in the lungs, are coughed up and swallowed, and that's the life cycle of that particular worm, and around in circles we go until the foal is either no more or looking very miserable. This is what happens. This is a blockage in the bowel. This is a colic surgery, and just wanted to share this with you because you'll never forget this ever again, and you will worm your foals forever onwards if you see this. This foal obviously had no chance of survival. This foal had not been wormed properly, and that is the shocking result in such a case. And all the management that we were talking about had not been applied here. Next one. And this is another foal, and you can see this one also died because of colic, and you can see the adult worms here in part of the stomach, and you can see it had diarrhea because it wasn't able to digest properly. This here is a picture of tracking through the lungs. It became absolutely solid, major pneumonia and respiratory damage, disease. So that was basically the roundworms. I thought we might be interested in seeing that. We should not be seeing that nowadays. Not finally, but the second last worm I want to touch base on is a tapeworm. These are transmitted by mites. Autumn harvest mites are typical for this. And it's at this time of year that we have a large increase in burden of tapeworms. They will also cause a blockage of the small bowel where it goes into the large bowel, and are more typically seen as a problem in yearlings, weanlings and yearlings, but mainly yearlings. And what's typical for these is that they have occasional colics, bouts of colic, are sort of ill-thrifty, and when you end up having to open them up, you find this large burden of tapeworms inside the gut, in the hind gut, and at the very back end of the small gut. But it's typically a disease of all age groups, and the problem with these is that they're very difficult to diagnose. We can't find them in dropping samples. It's really either in surgery when it's too late, or at a post-mortem when it's definitely too late, that we can spot them. But the only way to really decide whether the animals have a high burden is by looking for the antibodies that they've developed in a blood test. It's important to treat for tapeworms in spring and autumn, and this is roughly this time of year, and worms specifically for that purpose, assuming that all horses have an exposure to tapeworms, especially on farms that have had horses on them for many years and with relatively high stocking densities as well. Then the final one I want to talk about this evening is one that's typical for the young foal, 2 to 6 weeks of age. Who would have thought that? Well, these are threadworms, and they're passed in the mare's milk. How on earth does a mare do that? Well, basically, it's the udder that is infected as well, or contaminated. And it's important here that you worm the mares a month before foaling, exactly, or 1 to 2 weeks before foaling, to try to minimize the burden that the foal will be exposed to. And what happens is that the foal takes up these eggs from the mare's milk. They develop inside the foal and then cause damage in the intestinal tract and lead to diarrhea. It's usually a self-limiting diarrhea because the foals, as their immune system develops, tend to get over it, but some do not and have persistent diarrhea. It has nothing to do with foal heat diarrhea, which is a diarrhea that we see in foals when the mares are sort of coming to season 8, 9, 10 days after foaling. This is not linked between the two. For a long time, we thought that there might be an influence, but it's not. This is separate. This is an infection due to parasites, and we should be worming and making sure that our stables, our foaling boxes are clean, disinfected, or scrubbed down, so the foals are foaled into a clean environment, and that the mares have been wormed beforehand to ensure that there's a smaller burden of these type of worms for these foals. How do we diagnose worms? Well, many can be diagnosed by looking at dropping samples. I would rather you spend your money on dropping samples than on wormers, than on drugs. And this certainly is a very, very effective and efficient way to manage worms in adults. In foals and yearlings, we still have to resort to more regular worming, but certainly adult horses, especially if you are picking droppings on a regular basis, you can probably get away with doing dropping samples every 3 months or so, and checking to see what the worm burden is. This is in the adults. This will be mainly for these red worms, and to a lesser extent for these ascarids, for the roundworms. But if you do that in the adults, you can save yourself a fortune in, and your paddock management and stable management is good. You can save yourself a fortune in drugs, and you'll avoid increasing resistance to those drugs as well. Our horses here in our paddocks, those in that miserable tin shed you saw at the start of the presentation, I don't think we've wormed them other than for tapeworm at this time of year and in the spring for numbers of years. And our worm egg counts, which we check sort of every 3 months, 3-4 months, have been zero or very, very low for a very long time. As I say, there's no animal with a zero worm egg count. And but we rigorously pick poo off our paddocks. So a dropping sample, and that does not mean that our lab technicians need to get a whole dropping. One fecal ball is plenty. And what they do is they make a mush or soup of that fecal ball and then put it in a special solution and let the worm eggs float to the top and then look at them under a microscope. However, there's certain worms that we can't find in or are very difficult to find in dropping samples, and those are the tapeworms and these small Strongyle. And for that, blood tests will be an indicator to tell us what the burden is, because the animals will be producing antibodies against these proteins that these are typical for a tapeworm or a small Strongyle, and we can follow these antibody levels in the blood, and that will give us an indication of how serious the infestation with those particular worms is. So, worm management program. I on purpose have not put up a wormer because I'm not going to sell you any wormers tonight, but I've put up our lab technician who spends her life looking at poo. As I say, that to me is part of the very, very important worm management program, as is stable hygiene, especially in the young foals and foaling mares. Imagine being born into deep litter that is full of shit, excuse my French, and full of worms. You don't have a chance as a young foal to grow up in a healthy environment. So stable hygiene is extremely important, as is pasture management with regular picking up of droppings, targeted worming. Now, for brood mares shortly before foaling, a month to a fortnight before foaling, which is also when you should be boosting her from a vaccination point of view for flu and tetanus, and then regularly as a foal. This is the exception to the adult. We should be regularly worming foals. And when should we be giving the foals their first wormer? Well, usually at 1 month of age, 1 month to 6 weeks of age, because of those worms that they can pick up through the udder, but also to diminish the burden with especially those roundworms. And we should use wormers according to the worm cycles and seasonally, depending on when we have the highest expected environmental burdens with these different worms. And then, of course, manage our stocking density where we can. Worm egg counts are especially important in the older horses, and blood testing where we suspect to have diseases caused by tapeworm or the small red worm. But I can't give you a master plan on worming and the drug side of it. I think that you've got to tailor to your own particular farm and to your own particular needs, and that's best done by discussing a worm plan with your vet. So if you know that, discuss that at the next possible opportunity, especially if you've got young stock that you're rearing at the same time. Try to limit the use of wormers in adults to avoid drug resistance, and here are just examples on the right. And regularly worm foals and yearlings with the appropriate drug, and especially with our heavy horses, at the appropriate dose rate by body weight. Don't forget, it's easier done. Know what your foal's weight is and your yearling's weight is, and don't underdose the animals, because if you don't give enough, you are just encouraging drug resistance. So it's very important that we should know what the body weight of our horses is. And of course, in our adult horses, in our Suffolk horses, don't forget that these individual tubes of wormer are designed for riding horses, for the riding horse breed. So they're generally geared at 450 to 600 kilos, which is of course not what an adult Suffolk is. You want to be doubling that type, the dose rate, or doubling the doses. So an adult Suffolk will be anything from 800, 900 to 1100 kilos. And all of those of you who have something that's over 1,000 kilos, please look at their girth lines as well. So, you know, they might be just a bit on the tubby side, but it's important that the drugs are used at the appropriate recommended per weight dosages. So going from there, some just quick acknowledgements and thanks. Alistair Foote, the head pathologist, and Richard Payne, our surgeon, for providing us with this evening's movie entertainment under the microscope and in surgery. And I frankly admit that I've copied some of the, not the slides themselves, but the layout of the slides from this particular website here, which is a good one to go to if you want to just follow through. It's an Australian, I think it sounded like an Australian or American website, but I've taken some of the structure of the presentation from there. There's some interesting information and far more detail on that as well. And if you want to read a bit further, there are some fact sheets that the practice has produced, which might be useful to you if you want to look into things into a bit more detail. But the other very, very important source of information is your own vet at home. And the take-home message is get yourself a good wheelbarrow, a good poo scooper, and get out there and pick poo. I'm happy to take some questions if there are any there. Thanks very much for tuning in to this evening's webinar.
Thank you, Fred. I don't know whether I just have got one question for you, and this is probably an ignorant question, but why are people not doing it? And is it the cost? And are there regular sort of testings that can be done? Are there schemes out there that you can do testing on a regular basis?
Yes, I think why are people not doing it? Well, I think one of the reasons is, well, I think there are probably two reasons. One is the cost of wormers, or the perceived cost of wormers, and also possibly the perceived cost of laboratory tests, although a laboratory test, as far as I know, is cheaper than some of the wormers out there. And time. It takes time to go out there and pick poo, and it takes discipline to do it. How often should you be picking poo off a paddock? Well, twice a week at least, as you would muck out a stable on a daily basis. So it's those two aspects there. And I think some people, unfortunately, haven't learned about this. So it's part of good animal and horse husbandry to be following this advice. Several practices offer schemes, general horse health schemes, which include worming and vaccination packages. And it's worth talking to your own vet or the practice you're dealing with to see whether they do that. And within that, get into a management parasite and vaccination scheme to prevent parasitic disease as well as infectious viral diseases or bacterial diseases.
Thank you, Fred. Are there any other questions? I don't know. Steph, do you want to control this? Because I can't see everybody.
I don't know if anybody raises their hands if they'd like to ask a question. Joe would like to ask a question. Do you want to unmute yourself, Joe?
Hi, I just wondered what your views were on the saliva tests for tapeworm.
I think, yes, that's being propagated at the moment. I think there is some use to those. I don't think they're as accurate or exact as the blood test itself, but they are a good indicator. The blood test itself gives you a teeter, which gives you a measure to compare future samples with as well, whereas the saliva is probably a bit more dilute and not necessarily, it just gives you a yes or no answer rather than a how much answer.
Because when I've had I've been using them for the last couple of years, and when I've had them back, they do give a high to low ratio rather than a yes or no.
Yeah, but it's not as tailored as the blood result.
Okay, okay, thank you.
We like blood.
Okay.
Anybody else have a question? I think that's it.
Charlie, any comments from your point of view?
No, thoroughly enjoyed it. It's one of my favourite subjects to talk about worms.
Well, if there are no further questions, Fred, can I thank you for giving up your time this evening? Really useful, and I think Steph will be uploading it on the website so that we can use it, or people can use it ongoingly. And thank you for our second webinar. We've got another one next week. Andy Dell is going to give us a talk or webinar talk on the Spark system and the use of genetics in keeping the rare breeds going. So we're looking forward to that, and that is on the 11th at 7 o'clock in the evening, I think. Is that right, Steph? Nod. Yes, it is. So we look forward to that, Andy, and nice seeing you tonight. But Fred, thank you very much, and thank you all for joining us, and I hope you found it useful, and we'll look forward to the next one. Thank you.
Thank you, everybody, for tuning
Thank you,
in.
Fred.